We usually have Ilan talk regularly in one committee, but then in our talk normally we'll mention that people who have acidic blood, but then we have medical professionals, they are arguing that how come blood can become acidic and what actually is the reason why our blood becomes acidic? That's the first question. The second question is, can bioelectric or EFT help in blood diseases such as SLE? And then we claim that E-line or EFT is safe, but then why do we we refrain pregnant ladies from sitting on it? Actually, in terms of medical, how we say it's safe, but how do you explain to our customers if they ask such questions, because we are not medical professionals? Thank you.
Okay, thank you. The first question I already explained. Right? That the blood is never acidic unless you are about to die. Okay? So people in general who are non-doctors can be excused to say, oh, blood acidic. But then you should now bring up your level of knowledge and understanding and talking to be more precise and accurate, so that when you talk to doctors, also the doctors will not turn around and say, better not waste time this person talking nonsense. Blood also acidic. Alright? So from now onwards, do not talk about acidic blood. As long as you're alive sitting there, your blood is slightly alkaline.
But doctor, it's not acidic, but is it true that it is thickened?
Oh, thickened is a different thing. Right? Your blood can be thickened but not acidic. There are many reasons for blood to be thickened. There's two different things. Okay? But an acidic blood is more likely to be thicker. So remember again, the blood is always maintained in a very narrow range of pH. To be precise, 7.38 to 7.42. But there's a rule of thumb, senang nak ingat, 7.35, 7.45. Right? Outer extreme, not so healthy, tapi still okay. So meaning the body will always make sure that pH is maintained at the expense of the rest of the body. Understand? Right? And the pH because the blood goes everywhere. Alright, the body has its priorities. It has to maintain the brain, the heart, and the crucial organs. Then the others not so important. So those are the ones that are going to suffer. Right? So when you're talking about acidic blood, right, it's a very loose term. A more accurate term should be an acidic body, implying that there is excess acid in the body than it should, right? But if you actually check, the blood will still be alkaline. So more to understand, Okay, be careful, because if you want to excel in sharing about this, you must also have the accurate knowledge and accurate way of conveying, because when you talk to people who know the subject, then they're going to rubbish you. Okay? About SLE, you forgot my precondition that do not ask difficult questions. No, joking. Good. Whether it's SLE or any other chronic diseases, the same answer applies. That first of all, this is not claimed to be a therapy for a medical disease. Right? Number two, therefore, don't ever make any promises. But it is not wrong to convey a message that is reason to believe that it may help in any form, in some way, because of the many beneficial things that this therapy can do. Right. If ever anybody is to recover from any disease, the body must become healthy. Right? The ones who rely on drugs, right? The body never get healthy, but under control. Right? There's a difference. Okay? Two people with high blood pressure, one take drug, within 1 week, blood pressure normal, under control. But the other person decides not to take drug, lose weight, exercise, cut down stress, blah blah blah. Takes 3 months to have the blood pressure normal. But this person can continue like that. The one on the drug, lupa ubat 3 hari haywire. Because the person, right? The body never became healthy, but the blood pressure was suppressed by the drug. Right? I'm stressing this all the time in my writing, in my talks, to make people realize that is a major mistake to rely on drugs, because you have a false sense of security. You think your blood pressure is normal? Yes, blood pressure is normal, but suppressed by the drug. Your body system all haywire. Right? You don't believe me? Just stop your drug for 3 days. Okay. So same thing when I'm answering this to imply that. So whatever chronic disease you have, these people, they'll be on drugs. Right? They'll be on some form of drugs. Chronic disease will be some form of drugs, because that's the way the doctors treat. But very little attempt is made to try to help the body recover its health. Right? You all have grown up and heard and endorsed this statement: the body can heal itself. Yes or no?
Yes.
You all have heard, you all say yes, yes, yes. How come the body can heal itself? So many people are sick. Yeah? 45 to 50% Malaysians got high blood pressure, 15 to 20% got diabetes, how many percent got cancer, how many percent got heart disease, macam-macam. How come? Pergi mana-mana, the body can heal itself. If the body can heal itself, then the body got no business getting sick. Because the moment you're sick, it should be healing itself, self-healing. Right? So are we all just lying to ourselves when you say body can heal itself, body can heal itself? But you know, left, right, center, your uncle, grandfather, your mother, boyfriend, ex-boyfriend, some more getting sick. Okay. The body can heal itself. Right, but there's the small lines. Right, provided, right, you give it a chance. Provided you provide it with all the necessary nutrients it needs. Provided you keep it in good condition, including exercising enough. Right, provided you prevent it from being poisoned by the toxins and the rubbish that you bring in. True enough. Right? Provided you keep it away from infections and etc., etc. So yes, but you have to be fair to the body. Under those conditions, yes, the body can heal itself. Right? And sometimes it's fantastic. I am in the process of helping one gentleman. You wouldn't believe this guy. High blood pressure. Maximum went up to 220 over 110. Crisis, emergency masuk hospital. Yeah? In the end, ended up with 3 drugs to control his high blood pressure. 3 drugs. He was not even overweight. Right? But he was a smoker and a drinker. But he was not overweight. 3 drugs to control high blood pressure. Would you believe if I say that now his blood pressure is 120 over 70, no drugs? Okay? It is possible. No, it is possible.
Yes.
Okay, so the answer for SLE is, ma'am? Okay, so the person who said, don't make the mistake of making a promise, right? Tell the person that it's worth trying, right? There are many possible benefits, and if you're lucky, even the severe. If we cannot talk about cure at all, right? Okay, but we can expect some improvement. And if there's no improvement that she's looking for, you can still tell her that we know there are other benefits that you may not even feel, right? That's happening because the science says these things are happening in your body. Okay?